Hi, this is Dr. Veni from Venro Healthcare. Today we're going to talk about a bacteria that's attracting a lot of attention from our viewers, and that is Helicobacter pylori, also called H. pylori. This bacteria is of interest to many of us, especially those who have suffered from ulcers before. It is quite different from a number of bacteria out there because it's one of a few bacteria that can survive within the acidic environment of our stomachs. Now, a normal stomach ordinarily has acid, and most of the germs that we eat with food are actually destroyed when they reach the stomach because of the acidic components of the stomach substances. Acid is also useful in the process of digesting food. However, that acid needs to be produced in regulated amounts for it not to be dangerous for your stomach and for you. So this bacteria, like I mentioned, is one of a few that can actually survive in the stomach environment. When you're infected with the bacteria through eating or consuming contaminated food, or through contact with individuals who might have this bacteria, like through contact with their saliva, the bacteria will go to the stomach and attach itself to the lining of the stomach. When it attaches itself to the lining of the stomach or to the inside of the stomach will produce more acid than it usually does. And in the process of producing that acid, the extra acid or the excess acid is what in the end will cause ulcers or wounds within the stomach. So it's very important to have treatment, to get treatment in case you have H. pylori. So when do we test for H. pylori? In most cases, it's not useful to test people who have no symptoms. So your doctor will likely request for you to test for H. pylori or Helicobacter pylori if you have symptoms suggestive of ulcers or symptoms that many ulcer patients get. And what are some of those symptoms? Some people might get a burning sensation in their stomach. Other people get a lot of gas within their stomachs, and others generally get abdominal discomfort. The symptoms depend on the individual and on the amount of acid that's produced. So how do we test for Helicobacter? A blood test is available. There are some stool tests that can also be done on your stool. However, most of the tests available are blood tests. And that test, once done, will detect what we call antibodies that have been produced to fight the bacteria. However, in some individuals who do have Helicobacter or have had it before, you might have the test turning out negative. That in itself might rule out Helicobacter, but it might not rule out ulcers, as there are many other causes of ulcers that might not be related to this bacteria. So once you're diagnosed or found to have Helicobacter, you can be treated with antibiotics. Now you need a prescription for these antibiotics, and it's not good to self-prescribe these antibiotics. So should you require any further information about ulcers or about H. pylori, please do contact us on our numbers or do contact us through our social media pages, and someone who's got all the information that you need will contact you to provide that information. And remember to subscribe to our channel for other related health content. Thank you and goodbye.